Millions and millions of people are mewing. Are what? Mewing? I didn't even know what mewing is. In fact, I'm not sure I still know what mewing is. And today I'm here with my great friends and colleagues, Sydney Avis, the executive director for the Airway Revolution Foundation, and her father, Dr. Victor Avis. And together they did found the Airway Revolution Foundation, which of course we want to talk about and we will talk about. But today our topic is mewing because guess what? Mewing is such a big thing. There's now the first annual conference coming up in New York, and Sydney and Dr. Avis are speaking at it. And I couldn't be happier. That's exactly who needed to speak at MewCon. So, Sydney and Dr. Avis, welcome. And please tell us all about mewing. Tell us about yourselves. Tell us whatever you want to tell us, because I am out of the loop because I didn't know till y'all started telling me to go see so and so and so and so on TikTok that mewing was a thing.
Well, I'll jump in. Thanks, Gina. You and I have been friends for a long time, and you're my cardiology specialist, so I'm also your patient, and there's nobody better than Dr. Gina Pritchard to look after your health, and I mean that. She takes care of all of my family. So no one can be clearer than a 12 or 13-year-old and to the point when you ask them what mewing is. So when I have the opportunity with a patient or a child of a friend to say, hey, by the way, do you know what mewing is? Let me tell you, they know. And so yesterday I had a 15-year-old and I said to her, I said, do you know what mewing is? And a big smile went across her face, like, how could an old guy like me even ask such a question? And she said, yeah, you do stuff to get a stronger jawline. And I had another friend of mine, Phil's daughter, who was on the phone, Emmy, and we said, Emmy, do you know what mewing is? And she said, yeah, you do exercise to get a stronger jawline. So they are correct. Mewing is about doing exercises to develop a stronger jawline. I will say an off-label use of mewing has become a sign of disrespect, and that children in a class, when asked a question, will often now point to their jaw, keep their lips together, not answer the teacher, and they're implying by doing that that they can't answer your question because they're busy mewing. Mewing has millions, and in fact, I believe over 1 billion people have in some way interacted with websites, YouTube videos, this whole concept of mewing. And so it is really a phenomenon. You want to add anything to that?
No, I think you pretty much covered it all. Yeah.
So I then think it begs the question, why would Sydney and I, as co-founders of the Airway Revolution Foundation, agree and even be honored to speak at MewCon 2024, which is next Thursday here in New York City. It goes, I think, from 10 to 4 p.m. People
Next Saturday.
Next Saturday? Okay.
Yeah.
People can attend live or they can stream. And so here's why, is that mewing is, first of all, it's named after the Mew family. And John Mew is 95 years of age, and Michael Mew, his son, are both orthodontists outside of London, England, in Purley. In 2011, I went to Purley, England, to learn with John and Michael Mew. Mewing, and that term was not born then at all. It was a decade later. But I learned there about nasal breathing. I learned there about orthodontics, which would create more tongue space and enhance both the look of the face and how we function and breathe better. And it made so much sense to me that I changed my approach to orthodontics to be focused on creating health, which would be better airway health, upper airway health. And so the origin of mewing is based on John Mew and Michael Mew. And somewhere along the line, Michael was speaking and he was talking about exercises that could improve muscle tone in the face and potentially help grow the face forward. Somebody got a hold of this, and instead of calling it myofunctional therapy or exercises for the face, they coined the word mewing. So it wasn't Michael Mew, to my understanding, that coined it. It was somebody else that heard him speak, and it became
Social media phenomenon.
a social media phenomenon. And the other thing I'd like to say about it is that I think there are many examples of something that could be significant and it doesn't catch fire or ignite until it's rephrased or reformatted, or somebody has a better way of packaging it. And so I think mewing is myofunctional therapy, but it's been packaged differently, and the demographic that's interested in it is, 8 to 15-year-olds, which would never be interested in myofunctional therapy, but they are interested in mewing because they're interested in looking better. And so I think there's an opportunity for Sydney and I and others to connect that audience to the fact that if you're doing something to make your face grow better and have better tone, that we can be the people that help connect the dots between mewing and better health. And that's our purpose. That's why we're really excited to participate at MewCon. And our talk is beyond mewing, because we are going to connect the dots between form and function.
I love that. Thank you. That helps all of us understand better. One thing I'd like to ask you, for people that might not have ever heard the term myofunctional therapy either, tell me if this is correct, but myo means muscle, function, the function of the muscle, but particularly those who are healthcare professionals that take a rigorous certification to become a certified myofunctional therapist, understand all of what you just talked about, but on an evidence-based level, and see patients in clinical practice, right? To basically, I'm not trying to make it sound simplistic, because it's not, but someone has taken that concept, which is very in depth and can truly impact someone's health and facial aesthetics from an early age, like very young children to the elderly. Talk to us a little bit more about myofunctional therapy, because I want everybody to understand that maybe there is a lot of people talking about myofunctional therapy as well, but there are healthcare experts to seek out if you truly want myofunctional therapy. And tell us a little more about that.
So since Sydney, as a patient, has gone through extensive myofunctional therapy, I think your perspective on it is really valuable here. So you talk about what it is.
Well, I think really it's almost like physical therapy for the face. I know there's like trendy things now, like face yoga, and there's face gym that you can go to where people are kind of working out your face. But I think it's that concept of doing different exercises to create better muscle tone in your face, and using muscles that you might not be using. Because I really think it is, most people these days are not using the muscles that they are supposed to be using in their face. So we're not swallowing properly. Maybe we're not, really chewing food because we're so used to processed soft food right now. And I think that there's confusion. If you're chewing, you're speaking, you're doing it properly. But is that true? And myofunctional therapy really helps you start to understand where things should be in your mouth and help the growth and development of your face, especially in children, not as much in adults.
Yeah, I think that's great. I think the other thing I think we're all sensitive to on this is that for those who have trained, either they come through speech and language pathology training programs, many of them have doctorates, and others come through dental hygiene to become a myofunctional therapist. To some degree, their nose can be out of joint, that somebody that doesn't have a certification can all of a sudden be teaching mewing, or you can learn mewing online. And I can understand that. I just think that we've gone from maybe thousands and tens of thousands knowing what myofunctional therapy is to now hundreds of millions knowing what mewing is. And so I think it's an opportunity for professionals to take a much greater pool of people that are at least interested, and then apply better thought and training to help these people that are interested in doing something to have better facial muscle tone, and also connecting it to maybe some underlying health issues that they may not be aware are connected at all. So we're sensitive to those that have spent a lifetime of training and clinically seeing patients one-to-one, to say, hey, how dare somebody come along and say it's all about mewing when we've been myofunctional therapists and dedicated to this, and there's a lot of science behind it and research papers. So I just want people to know that we are sensitive to that.
I think it's so important for people to know that it is based on a very valid, like you've said, Sydney, physical therapy for the face, and people study long and hard and have expertise in that area. And I think the same thing probably or something similar happened to physical therapists who were helping people rehab over serious injuries and improve their health and become more fit. And then there was certified personal trainers and, people just doing it that weren't educated at that level or maybe didn't have that level of expertise, but it blew up, right? More people were working out. So it's a similar concept, I think. But you were the first person that I had even heard the terms, Victor, of myofunctional therapy when we were working together. I don't know, 2015 maybe, or somewhere around in there. And you were the first to have a myofunctional therapist in your office to work particularly with the children. But of course, that was after you've told us earlier in this video that you went to learn about the new way to do orthodontics early on. You were an early adopter of that so that you opened up the airway more while making the teeth beautiful, as opposed to maybe making it more crowded or less favorable, but beautiful.
Yeah, I think the one thing that struck me when I went out to learn with the Muse is that I picked up a book on a coffee table that was very thin, still exists. It's called Close Your Mouth. And I was like, what is this about? And why is it in this office? And it was, literally about an hour read. And it was all about nasal breathing and its impact on health. And Sydney and I have talked a lot about how you simplify it. But the truth of the matter is, if you breathe through your nose, that is what it comes down to. And just you talk about it really nicely. Why do you say that?
I think because it can get so complicated, and I just think medicine and healthcare is complicated. But I think the crux of it is that if you're breathing through your nose and your mouth is closed, things are going to work out better for you. Your face is going to grow in a different way than if you were perpetually breathing out of your mouth and you had your mouth hanging open. It's just going to be different. And really, our talk at MewCon is about how form follows function. Yes, form follows function. So, there's a lot of criticism around mewing that it's just about aesthetics. But I think that that's where we come in, because depending on your form, your function is going to follow it. So if your form is mouth hanging open, which was what I did my whole life, since I was born, pretty much, my function was poor. I couldn't breathe out of my nose. I suffered from allergies. Then I had gut issues. I had learning challenges. All these things kept kind of piling up. Now that I've changed my form, I had double jaw surgery. I can breathe through my nose. I continue to work on myofunctional therapy. My function is much better. My anxiety is better. My learning is better. The fog is gone. So it just really shows that it's not all about aesthetics, but your aesthetics are telling you something.
Very interesting. Very interesting. I have so many things I want to ask you about that. But one thing that it makes me think of is with the interview I did with Lisa Palladino, that it's not like we want to tell children or anyone of any age, like close your mouth or like blame them, like you need to change that. Sometimes it's the only way they can get air in because their nose is stopped up or they're so narrow on the inside of the airway passages and things like that. But back to the soft food, Victor, we're setting up from newborn forward, we're setting our children up for potentially these problems, because as the face is forming in the early years of life, we are not feeding them things like we did many years ago. And a lot of times there's trouble even when they're first born, latching on and breastfeeding appropriately, or even bottle feeding appropriately for some newborn babies. And so take that back a step. I've been reading some things that perhaps it's nutrition of the mother while the child is growing in utero, that the face is different even at birth. I don't know if any of that's true or not, but it's definitely worth considering. Anyway, so from in utero, or for sure from newborn stage, sometimes we know the most important thing, babies got to have nourishment. They got to have nourishment. They got to grow. But, there's not we could be harming them in some way, is that is an early development of the facial structure and the nose and the airway, right?
I think you kind of hit the nail on the head. Like there's no one to blame, because the reality is that most people don't know this information. And that's why, as a foundation, we're really trying to create that awareness so that people know what to look for or have questions for, medical professionals to help themselves, but also, when they're bringing kids into the world or have young families. We're so used to the status quo, which is, baby food out of the tub, out of like the little jar, and give them a pacifier. But these things can really be detrimental. And the fact is that most people don't know that that's the case.
Yes.
So I think really starting creating that awareness so that people have all the information and they can make the best choice for their families. We don't want to make people do anything that they don't want to do, but I don't think it's fair to let people continue on doing things that can be harmful when they don't have all the information.
Yes. That's so good. And it even makes me think of course, the problems that I see in my practice of people who are much older because they've had this problem their whole life and, of course, weren't even aware, which is the whole reason you formed the foundation, to raise awareness and help people get the resources and the education and the care that they need to correct this as early as possible, or find out as early as possible if there is an airway related issue. Late in life, I'm like, well, I wonder what the chewing aspect, how that relates to people that I see that are 40, 50, 60, 70, 80 and beyond. And everyone, we're focused on getting in our protein, but I just learned recently that a lot of the protein shakes, which that's a great way to get your protein in. And I still recommend it if you need that to get your protein in. Of course, there's a lot of terrible ones, but protein shakes, someone did a study looking at blood sugars after a protein shake with comparative ingredients of eating protein of some sort. And that chewing aspect of it slowed the glucose spike and you digested it more slowly. There was a much lower glucose spike, besides the fact that we all know that's healthier for our digestion. It's healthy for our facial structure. That would be a form of mewing, to actually chew your food, not just swallow a protein shake, right? So
Yes.
anything y'all want to elaborate on that?
I think just in general that culturally, there's a lot of things that are stacked against us, developing in a way, whether it be nutritionally or functionally, chewing, and even breathing in today's society, because we have so many more allergies. We've moved from living outdoors to indoors. We have carpets, we have pets. And so we have a lot more environmental issues that clog our noses. And so that's one strike. And then, and it's so politically charged, but we're in a time where very often both parents have to work economically. And so the ability to breastfeed for 6 years culturally doesn't fit our norm. And so that has a downstream impact. And it's like you said, there's no guilt, but if we make people aware, there may be places where they can intercede. Well, maybe you can't breastfeed for 6 years, but maybe you could wean off of a bottle onto food that you have to chew rather than going to processed food. And so I think we have to understand that, we're not in the Paleolithic era anymore. And you don't have to just be on a paleo diet to be healthy. But if we educate people about what the environment has impacted our health and ways that you can intercede, that would be number one. And I think the other thing is there are so many downstream effects that people are not connecting to good breathing and good sleep. So, for instance, in children, ADHD, that can be rooted in improper sleep. And so instead of putting people on amphetamines, maybe fixing their sleep could help their child in a much more impactful way. And people aren't going to know that unless we help educate. And so same thing, it could be anxiety and depression. Well, maybe it needs a medication, but maybe it's rooted in the fact that you can't sleep. And in my world, I had a woman yesterday that was referred by another dentist that did a beautiful dentistry. And she clenches so much, this woman, and they're so afraid that she'll break all the dentistry. And so I looked at the dentistry, and she even breaks every mouth guard that she gets, and they keep printing them. Fortunately, they can manufacture them weekly. She breaks them. So I said, let's look at her sleep. I mean, she's averaging 2 to 3 hours of sleep a night. She has difficulty falling asleep, and when she wakes up, she's up. Well, I think that's the root of her clenching problem. But even if it's not a healthy issue for her long term. And so I think we all see through our lens. You know, I'm the dentist, so I see clenching and grinding. And now I see in this person, wow, I think sleep is the root cause. I don't think any dentist can adjust these teeth more refined than the dentist that sent this person to me has and fix the problem. It's a problem that's not here. It's a problem that's rooted in probably in her sleep and in her brain. And so anyway, I think it's really important to recognize that sleep is not only one of the 4 keys along with nutrition, exercise, and stress management. I think it underlies, it's the foundation for those other 3, because we spend, you know, a third of our day sleeping, hopefully, and it's when rest and repair happens. And if you're not getting that, your ability to be nutritionally competent, manage stress, and exercise are all impaired. So I think it's a critical piece. And, you know, it's related to mewing, because that's making people aware that, hey, how they're using these muscles and how their faces develop impacts their look. And we're saying, hey, their appearance may be part of why either they have anxiety or learning problems or high blood pressure or cardiovascular disease. And they wouldn't know that unless people like us come together and connect those events.
Yes, absolutely. I want to pause on that for just a minute because, for one, if we can get this message in a widespread fashion to those that are caring for children, the mothers, the fathers, the aunts, the uncles, the teachers, then we can make such change. So the example you gave of the person that came to you and you were afraid she was going to break all her dentistry, or she was afraid, you know, she's broken every device that a guard that they put in her mouth, shows the impact of what is happening during sleep. That's what I want to talk about a little bit, because you started the Airway Revolution Foundation because of Sydney's sleep and airway related story, and to raise awareness to others. And oftentimes we've used the term sleep disordered breathing. And I don't know if it was you or someone else that said it's really breathing disordered sleep. Because if someone's clenching it, grinding at night, then the body is trying to keep you alive. Would you say that's true? Like, oxygen levels have dropped. Maybe you stopped breathing and maybe you didn't. Maybe you're just mouth breathing at such a low level that, or whatever kind of breathing you're doing, but it's such a low level that it's not oxygen that's high quality, meaning it's 96% if you're wearing one of those O2 saturations on your finger, or if you've ever had one of those on you during COVID or when you were in the hospital. That oxygen saturation level, meaning how much oxygen is actually circulating in the blood, should be 96, 97, 98, 99, 100% all night long, while we're getting restful, reparative sleep, as you've said, Dr. Avis. And when that's not occurring, the body does everything. That's its number one priority at the time. Yes, the body knows you're trying to get restful sleep, but you're going to die if you don't wiggle or cough or move around, have this disordered sleep. The nervous system will wake yourself up because something bad is happening, and they're going to wake you up, because why else wouldn't you have adequate oxygen? Just elaborate on that a minute, because a lot of people think snoring is cute or funny. I did when my grandfather snored when I was a young child. Now I realize, wow, if we had gotten him help at that stage in his adult life, it would have saved him a world of hurt at the end of his life when he was so unhealthy and sick. And we think even babies, it's cute when they snore. And I know there's times when there's allergies and things are going on, but snoring and clenching and fitful, fragmented sleep, poor quality sleep, number one now, top of the list in my workup and yours as well, is what's that oxygen level all night long? Just elaborate on that a little bit, because it is one of the main things that, as you've said, combines health and life and all of the future health that we want and longevity with mewing, which has become a cultural social media phenomenon.
Well, thanks, Gina. I mean, we called our foundation not the Sleep Revolution Foundation, but the Airway Revolution Foundation. and it was purposeful because breathing and problems with breathing are most often not recognized, because if you're alive, you're breathing. And so to some great degree, other than those who are really kind of self-aware, whether it be through yoga or through breathing training, most of the population just takes breathing for granted until such time as they have emphysema and they have to be put on an oxygen machine because they can't catch their breath, or they have asthma. So breathing, I think, to the great degree for the masses is just overlooked. It's just something we do because we're alive. But the truth of the matter is, breathing can be dysfunctional, and most often it is, meaning that we either overbreathe, we breathe too many times per minute. Our breathing is shallow from the chest rather than from the diaphragm. Our breathing is through the mouth rather than through the nose. And so there's all these things about correct breathing that most of us don't know. But on top of that, it gets amplified at nighttime, because at nighttime, you don't have some of the abilities to compensate. And so just from posturally changing, laying on your back or on your side or on your stomach, and some of the conscious mechanisms being turned off, particularly during the deepest stages of sleep and REM sleep, the ability to compensate is not there. And so the dysfunction with breathing is amplified at nighttime. And that can look like disrupted or fragmented sleep, which in short just means you're not getting the deep quality sleep that you need for your body to repair itself, for thoughts and memories and new learning to be coalesced and organized. And so when this happens, everything from cognitive function to anxiety, depression, all these things are out of sorts. And so breathing is the root cause of upper airway disorders, which is the root cause of any obstructive sleep disrupted breathing or breathing disrupted sleep. And I have to give Roger Price, who is a respiratory therapist, is the one that I first heard saying, hey, it should be called breathing disordered sleep.
I think one thing that you could elaborate on that might be interesting for people, because we started off this conversation talking about appearance. So maybe just talk about, when we say form follows function, what is the form we're talking about, and how does that correlate with the function? Because the reality is a lot of the population has started to look alike, with long faces and dark circles under their eyes, and sometimes, the bump on their nose. Why, when we see that, do we say, hey, there's a deeper issue here? Just talk about that.
So behind the teeth, behind the lips are the teeth, behind the teeth are the tongue, and behind the tongue is the upper airway. And so when faces are either flatter or longer, that airway is compressed or narrowed. And we don't know how much the airway can be narrowed before it becomes a breathing issue and a sleeping issue. And so the more that we have forward growth of the upper and lower jaws, and the more that we have width to accommodate the tongue, the greater the opportunity for our airway not to be narrowed or constricted. And so the form we're looking for is a forward lower face, a strong jawline, a very wide roof of the mouth that has room for the tongue, a tongue that stays in the mouth during speech, lips that are together during breathing. And so that's the form that would support upper airway health, which would then support better sleep.
And just, my understanding of when we talk about kids and pacifiers and bottles and breastfeeding, my understanding, and correct me if I'm wrong, is that when we use bottles or we use pacifiers, we're forcing the tongue down at an early age. So the tongue is not at the roof of the mouth. And when the tongue's at the roof of the mouth, it's the bottom of the nose. So when your tongue's at the roof of your mouth, it's encouraging nasal breathing, one. But two, when the tongue is at the roof of the mouth, the palate forms around the tongue, giving you a nice wide area. But when the tongue's hanging down, we're not having to use the nose, where our mouth is usually open. And even if your mouth is closed, but your tongue is at the bottom of your mouth, the palate has nothing to form around. So we get these narrow palates. And again, because the palate is the bottom of the nose is not growing to a place where we can really use it. And if you don't use it, you lose it. And then all of a sudden you have a deviated septum and you can't breathe out of your nose and the mouth is the only option. And it just gets worse and worse.
That's perfect.
Okay.
And I think Sydney, from her perspective, just tells it sometimes so much better than I do as a doctor. And that's why nasal breathing and tongue up on the roof of the mouth and lips together as a child encourages a different growth pattern. And that's really what the root of myofunctional therapy is. And that's really what the message of mewing is: lips together, teeth lightly touching, tongue up on the roof of the mouth when you're not speaking.
Yeah, there's so many things to say about that. One, and in just a second, I want to talk about the culture change and the cultural phenomenon of mewing and how all of these culture changes, it's like anything in life. There are some great things about it and there's some not so great things, sometimes horrible things about it. But I'm going to use myself and my daughter as an example. We had a great time with pacifiers when she was a child because I felt fully validated because I bought only the more expensive ones that were the new shape at the time. That was the thing moms did. Oh, I use this kind, kind of this brand because it forms the mouth more appropriately or whatever it is. I use the same bottle nipples whenever I quit breastfeeding. And so it's no judgment on anybody because I'm telling you, I was there. I did it. We had a great time, thought we were doing the best thing for our child. And she's one of those people, Sydney, that when you evaluated her, Dr. Avis, she could not touch the roof of her mouth with her tongue. And so people then grow into this form that may look one way or whatever it's going to look like, but where it's very difficult for them to breathe through their nose or impossible for them to breathe through their nose or impossible to have this function that we want because the form isn't there, as you've said. Anything you want to elaborate on that?
I mean, similar to your daughter, I mean, I was never breastfed. We used bottles. We didn't use pacifiers, but not because we knew any better. Just I think my great grandma said, "Don't give her a pacifier," and they listened.
Yeah.
But my parents had a black lab, and then they had me, and I was allergic to the dog from day one. So my nose was stuffy. I started breathing out of my mouth, and we didn't know better to do something about it. Encourage to close that mouth or, do something about the allergies, whatever that is. I know we were never going to get rid of the dog, but, do something more. And my entire life until I had double jaw surgery, I could not even get my lips together. When I wasn't walking, I was just resting. I could not get those lips together. I would tape my mouth at night and you would see my chin muscle just working so hard to try to keep my lips together because I grew up never using my nose, that my form developed in such a way that my mouth hung so open that I couldn't get my lips together. And that was really, for me, the root of so many of the issues that I had growing up.
Yes. Yes. So again, if that message we're getting out there, and you have both been talking about it for so long, as have I, but then somebody puts another spin on it. Like you were saying, Dr. Avis, let's call it mewing and make everybody want to do it. Then it's a positive change in culture. And I know there's a lot of people trying to solve the problem of how to get adequate nutrition to the newborns and to the children without injuring them and long-term with the airway give. And really closely tied to that, as we talked about, is the food, because going back in time, you were talking about your great grandmother saying to your mother, don't give her a pacifier. Great wisdom passed down. But I remember my grandmother and great grandmother being so excited when there was something new in a package that came out, because they'd been slaving it in the kitchen for so long. And not only was it very difficult to actually go and gather or grow or kill your food and then have to get it to a point where it's ready to eat, that was a lot of work. A lot of their life was consumed with that. So this new processed food, which isn't even what it was called at the time, was seen as such a help to mothers and to grandmothers and for the children. And I remember when not only could you get, my grandmother was so excited. She came home from the grocery store. Not only could you now get prepackaged cereal in the boxes, they had little individual ones. So I can send you home with one, and I can send you home with the Frosted Flakes or whatever it is. That's very little nutrition in there. You don't have to chew it. And it's terrible on so many reasons, but they saw it culturally as, wow, I can spend more time with my family now, or I can do whatever I want to do because I'm not slaving trying to just feed everybody. And then my one of, well, both of my grandmothers for sure, but I'm thinking of one right now that then started inviting everybody over because she was thrilled, because people were literally starving during certain years of her growing up, where there was not enough food to go around and nobody could find enough to prepare, much less have, then all you had to go through to prepare it. So when things started being more readily available, she had big parties, and she's like, she would take food around everywhere, like to the neighbors and particularly to poor areas. And that's a great thing, right? People, we're not starving. Here's a solution. But at the same time, now we know there was health payoffs too that were damaging.
Right. And I think that that's why airway disorders are not, 1 in a million. They're more like 1 in 3. And it is an epidemic right now. The growth and development is not happening how it's supposed to for most people. And it is because of cultural change. And we live in a time where things are fast. We need to eat quickly. We're on the go. We don't have time for this. We have to move, move, move.
Mm-hmm.
And I don't want anyone to think that we're negating that or we're not conscious of that. I just do think that it's important to have these conversations so that people know. And like Dad said, you can't be perfect. We don't even really know what perfect would look like because it's just not possible. But to have some more information that you didn't have yesterday to make decisions that are better for you. And maybe those decisions can't be made every day or every year, but I think it's important for people to have the awareness and then make decisions from there.